Physical examination strategies. Head-to-toe examination, part 4. Male genitalia. Inspect and note the distribution of the pubic hair. Inspect and palpate the penis for any lesions, sores, rash, or masses. Inspect and palpate the urinary meatus. Inspect the scrotum for lesions, rashes, color changes, or edema. Palpate the testes. Assess for inguinal hernias. Patient supine with legs exposed. Arrange gown and drape so that they are covering the abdomen and pubis. Hips. Palpate the bony areas anteriorly. Test ROM. Lower extremities. Inspect the knees for swelling, deformity, muscle tone, and alignment of patellae. Palpate the knees and test ROM. Inspect the ankles and feet for edema, ecchymosis of deformity. Palpate and test ROM of the ankles and feet. Patient seated facing examiner. Neurologic system, test rapid alternating movements, the ROM. Observe for leg dystaxia using the heel to shin test. Assess exteroceptive sensation. Assess the patient's ability to sense superficial pain. Test temperature sensation. Assess proprioceptive sensation. Test motion and position sense. Test vibratory sense. Assess cortical sensation. Test stereognosis. Assess graphesthesia. Test two-point discrimination. Assess extinction. Test plantar and Achilles reflexes. Patient standing, neurologic, observe patient standing, walking regularly, walking on heels, walking on tiptoes, and walking toe to heel. Instruct the patient to walk forward a few steps with eyes closed. Perform Romberg's test. Test for pronator drift. Spine. Assess posture. Palpate the spinal column. Palpate the paravertebral muscles. Observe ROM. Have the patient flex as if she or he were trying to touch her or his toes. Extend and move side to side. Female patient in lithotomy position. Remember to drape appropriately. Assess the mons pubis for general hygiene, pubic hair distribution, and condition of underlying skin. Inspect the vulva for lesions, edema, color, or discharge. Inspect the clitoris, urethral orifice, and vaginal introitus. Palpate the Bartholin's glands for masses, tenderness, or edema. Using a speculum, inspect the internal genitalia. Inspect the cervix, note color and texture. Inspect the cervical os. Perform bimanual examination. Palpate the vagina, palpate the cervix, palpate the uterus, including the fundus, palpate the ovaries. Perform rectovaginal examination. Thank you for your attention.